Well, thank you for having me here tonight. I'm really excited to be speaking to all of you. I am new to Lyme. I had the opportunity to attend the ILADS conference and just really excited and thankful that I had that opportunity. I learned a lot, and I think we're going to be able to implement treatments for Lyme into our clinic. We are a multi-specialty wellness clinic focusing on multi-body systems. So I attended ILADS in Chicago in November. I actually saw Dr. Maloney speak. I also want to give credit to some of my slides on here because some of them are from speakers at the ILADS conference. But I first of all just want to discuss some of the things that I learned mostly from the fundamentals course because it was a 3.5-day conference and a very large amount of information to take in, especially for someone so new to this. But the fundamentals, I really found that helpful to be able to just understand Lyme better and understand how to treat Lyme. So some big takeaways, as many of you know, Lyme is very complex. It oftentimes doesn't occur just by itself, but with other tick-borne diseases. The CDC has estimated that more than 300,000 people per year have Lyme disease, or develop Lyme disease, aren't necessarily diagnosed, but contract Lyme disease. Misdiagnosis is very common. It can take months to years for proper diagnosis to occur, and accurate diagnosis is challenging. 10 to 15% of untreated Lyme patients will go on to develop neurological complaints, and 60% will go on to develop Lyme arthritis. So Borrelia burgdorferi tolerates changing environments. It's very adaptable. The bacterial toxins can damage the mitochondrial cell walls, leading to free radicals in the body. It inhibits the antibody response, so reinfection is possible, as well as there's a lot of inflammation that occurs. The most common places for Lyme to disseminate in the body besides the skin are joints, connective tissue, the nervous system, and the heart. And then different types of Lyme, or I guess acute Lyme is somebody who's diagnosed right away, so prompt treatment equals obviously a better long-term outcome. Late Lyme, so there are diagnostic delays, there's no prior antibiotic therapy. And then persistent Lyme is someone who has been treated but continues to be ill or relapses, which is very common from what I understand. Co-infections. The most common co-infections, or some of the most common co-infections are Babesia, Bartonella, and Borrelia miyamotoi. Simultaneous infection of a host with multiple pathogenic organisms is common, like I said before, and they frequently occur with Lyme, so many of the ticks are carrying not just the Borrelia burgdorferi, but some of these other infections as well. So this increases the severity of the illness and complicates the diagnosis and treatment. It creates higher risk of treatment or of long-term treatment failure. So why is misdiagnosis so common? Lyme is referred to as the great imitator. So people present with symptoms that could be thought of as anxiety, depression, chronic fatigue syndrome, MS, fibromyalgia. So oftentimes misdiagnosed, and then if they're treated for those things, they aren't getting better because the underlying cause is the Lyme or the other tick-borne disease. Accurate diagnosis challenges. There's no known tick bite, or there wasn't a rash that developed. People have multiple complaints, so again, leading to a misdiagnosis. Exam findings are subtle or absent, and latent infection, so signs and symptoms of Lyme or of the infection can show up weeks, months, or even years later. Lab testing isn't always reliable, so we'll talk more about that. And then according to ILADS, the diagnosis must be made based on the patient's history and physical exam, and supported by diagnostic testing. So the testing challenges, there's poor test reliability and sensitivity. There's an uncertain impact of co-infection, so that complicates the diagnosis. And then early Lyme, there's not always an antibody response, so it doesn't, the test doesn't show up as positive if people are tested too early. The best test to confirm diagnosis is the ELISA, followed by the Western blot, which both of these also, as I understand, have issues in themselves. So the ELISA it has timing issues as well as it's a low sensitivity, so it doesn't always produce a true positive result. And then if you test too early or too late, it will show up negative. The Western blot, it also has low sensitivity or a low true positive, and this can be technician dependent, so if somebody doesn't know exactly how to perform the test, or the results might show up inaccurate. The two-tier testing is the best though, the combination. It does have the ability to obtain more positive results than single testing. So, and positive two-tier test and compatible symptoms equals a Lyme, positive Lyme, but a negative two-tier test does not rule Lyme out. Some other challenges, so higher risk of treatment failure in certain patient subgroups, so people with multiple erythema migrans or the bullseye rashes, people who develop neurological symptoms, maybe who are very ill at initial presentation or have multiple symptoms, and then continue to have signs and symptoms after antibiotic therapy are at higher risk for treatment failure. So ILADS recommendations, primary prevention, so prevent disease whenever possible. Secondary prevention is to cure an illness when it occurs, and tertiary is to reduce morbidity for those with chronic disease. Citing from Cameron, Johnson, and Maloney, the evidence base for treating Lyme disease is best described as sparse, conflicting, and emerging. According to ILADS, though, the treatments should be based on guidelines, but guidelines need flexibility, so everybody's different, and we need to treat each person and not have a strict protocol for everyone. And treatment should also be patient-centered, so patients definitely need to be involved in their treatment. So the ILADS guidelines discuss potential for prophylaxis with patients. If the tests come back negative, but you have all of the symptoms, then discuss treatment options. Single dose doxycycline is not recommended, and doxycycline 100 milligrams twice a day for at least 20 days, but oftentimes for 4 to 6 weeks or longer is recommended, depending on symptom recurrence. And then, of course, we need to do probiotics to prevent infection, C. diff infection, and just to protect the gut. Diagnostic uncertainty plus high exposure risk equals treatment, according to ILADS. And patient education is always important too, so how to prevent tick bites, what are the signs and symptoms of Lyme disease, just discussing those type of things. Initial treatment recommendations are 4 to 6 weeks of an oral agent. Doxycycline is the most preferred, as it covers other tick-borne diseases, but there are others that can be used. 4 weeks on average for lower risk patients and 6 weeks for higher risk, as well as frequent follow-ups to reassess symptoms and if we need continued treatment. So I'm going to probably mess this up, but I'm just going to say Herxheimer reaction is an intensified baseline symptoms after starting an antibiotic therapy, and that's an expected reaction. So another thing that patients should be educated about before they start their treatment. So ongoing management, frequent follow-ups with patients, like I said before, to reassess signs and symptoms. This helps to determine if there's persistence, progression, relapse, or maybe other tick-borne diseases. Extend the initial antibiotic therapy, possibly add an antibiotic or change the treatment course, and then retreat relapse or disease progression. And I liked this little cartoon. It says, "Good news, your lab results look great. Everything is normal. You are the picture of health." And so just kind of something that I feel like happens in traditional medicine frequently. Patient education. So shared medical decision making. We need to make decisions together as a provider and a patient. Discuss the signs and symptoms of co-infections. Like I said before, educate about the Herxheimer reaction. Discuss gut health, lifestyle modifications, and the risk for developing persistent Lyme disease. So my team, I work at Team Healthcare Clinic in Champlin, so I'm just going to tell you a little bit about what we do. We're a multi-specialty wellness clinic. We have 5 chiropractors, 1 who specializes in functional medicine, 1 who specializes in functional neurology, 1 who does acupuncture. Then there's myself, I'm a nurse practitioner. We have a physician assistant and a medical doctor, and then we have physical therapy and physical therapy assistants. So we see quite a variety of patients with a variety of illness or disease. So what's the root cause? Our goal is to get to the root of the problem, not just to treat the symptoms. With Lyme and tick-borne disease, we kind of already know that what the root of the problem is. We know that the infection is the problem, but what else has it caused? Any autoimmunity that it's caused? So getting to the root of that. We talk to patients a lot about what we call the triangle of health. So we look at body structure, pain and inflammation. So then blood chemistry and nutrition, and then neurological or psychiatric, so mood disorders, brain fog, dizziness, imbalance. So if we fix one without fixing the others, we're still going to have imbalance in our body. So we work to help people to alleviate the symptoms that are in all of these areas. The 5 pillars of health, so this is another thing that we focus on. So 5 different things that we focus on when we do our treatment is nutrition, exercise, hormones, detox, and the nervous system. And then we have our patients set goals. So what's something you would like to be able to do that you can't do right now? What percentage of improvement would you consider to be a successful outcome? So we do this with our patients because we might not achieve 100% success. So what is something that we can, our patient can be happy with? What's a goal that we'll strive to achieve? And if we can get better than that, then that's great. But it's not always the case to get, a pain level from an 8 out of 10 down to a 0 out of 10. So we just kind of work with people on that to set realistic goals. And then we have people journal too. Our health coach has people do health journals, but we also have some of our patients with like depression do journals just to kind of help them to go back and see where they were, because sometimes when you're in the midst of something, you don't always see that there are changes made. So an article that I found with recommendations by Dr. Horowitz, and this just kind of goes in with what we do at our clinic. So he says to treat infection, immunity, and inflammation, support detoxification pathways in the liver, skin, kidneys, and lymph system, and then eliminate environmental triggers, so like heavy metals or mold can also contribute to inflammation and worsen symptoms, especially if someone has Lyme on top of that. Balance hormones and manage sleep disorders. And then focus on nutrition. Are there nutritional deficiencies? Are there food sensitivities that need to be addressed? Western medicine meets functional medicine. We do both. So I prescribe medication if I need to, but we also do the natural medicine approach. Long-term exposure of the host immune system to the spirochetes and or Borrelia compounds may induce chronic autoimmune disease. That's by Singh and Gershik, and I just wanted to put that in there because we address the immune system so much. An infection can really lead to a breakdown of the immune system and contribute to autoimmune flares. So treatment with antibiotics is a must for Lyme and tick-borne disease. That's something that I learned at ILADS, and so definitely treating people with antibiotics, but also multi-system treatment is necessary. So looking at the immune system, inflammation and pain, hormonal changes and sleep disorders, neuropsychiatric and neurodegenerative disorders, the GI system, nutritional deficiencies and food sensitivities, and then again, heavy metals, molds, and co-infections. The 3 T's, so that's something that we talk about with our patients. We do testing, treating, and teaching. So testing, just an example of some things we do, a comprehensive blood work. We have a panel that we run on our patients. It's about 3 pages worth of blood work. We do have the IGeneX testing for Lyme. We do stool testing, adrenal function testing, micronutrients, food sensitivities, and then treating with antibiotics, supplements and herbs, nutrition, so anti-inflammatory diet. We work with people to just restore gut health. Chiropractic and physical therapy, acupuncture, brain rehab. Our functional neurologist does a lot of the brain-based therapies with our patients. And then we also have RTMS and neurofeedback, which I'll get into in a few minutes. And then teaching, we have health coaching, one-on-one health coaching, lifestyle classes, and then, of course, lab review and lifestyle changes. So functional medicine approaches, labs and other testing, nutrition, anti-inflammatory diet, supporting a healthy immune system, gluten-free, dairy-free diet goes in with the anti-inflammatory supplementation, and then the gut-brain axis. So if we treat only the gut, then we're not fixing everything. We need to treat the gut and the brain, or we need to treat the brain and the gut to be able to get a better response. So the gut is considered our second brain. It has neurotransmitters in it, and so people who have gut issues, if we don't address that, then they might continue to have neurological issues, or if they have neurological issues and we don't address that, then they might continue to have gut issues. So then I just kind of went through and I, from ILADS, from some of the different supplements and herbs that I learned about, I put those in here, as well as some of the supplements that we use. And then actually I met someone at a conference recently, and she had given me some ideas of things that she uses. So first of all, supporting the gut. So we want to prevent C. diff, antibiotic-induced diarrhea, prevent microbial imbalance, So antibiotics kill beneficial bacteria and yeast and interfere with digestion, nutrition, and the immune system. So Saccharomyces is something that we use. It's a yeast microbe. It can't be killed by antibiotics. It reduces antibiotic-induced diarrhea, and it's effective against Candida, C. diff, and H. pylori. So this is something that I recommend oftentimes if I put somebody on antibiotics. Enterovite, it contains butyrate and propionate. It's a blend of short-chain fatty acids for intestinal support. It's an anti-inflammatory. It helps to regulate microbial balance and function in the intestines, and it reduces oxidative stress. And then Megaspore Biotic is an immune system support. It contains spores rather than live bacteria. It's not affected by antibiotics, and it helps to support the gut microbiome. So some antimicrobial support. Grapefruit seed extract, it has antimicrobial effects against bacteria and fungus. Japanese knotweed root has antimicrobial effects even against the spirochetes. It increases blood flow to parts of the body where bacteria settle. It's anti-inflammatory, and it contains high amounts of resveratrol, which have antioxidant effects. So we use a product called Resvero, which is just purely Japanese knotweed root. Support for oxidative stress. Protandem is a combination of milk thistle, bacopa extract, ashwagandha, green tea extract, and turmeric. It helps to reduce oxidative stress and has the antioxidant effects. And then glutathione is an antioxidant, and it helps to repair damage and remove toxins. Immune balance, ashwagandha. This was one particularly that they talked about at ILADS. So it reduces anxiety, improves energy levels and mitochondrial health, has anti-inflammatory and anti-arthritic effects, and helps regulate adrenal function and cortisol levels. So we use something called adaptocrine, which has ashwagandha in it, and actually for people who have low or high cortisol levels, it actually helps to bring them to normal. So it's a really good one for people with insomnia or just some adrenal imbalance. Nitric balance is another one. It supports intracellular energy production, immune system balance, and it also supports the brain. So functional neurology, our functional neurologist works with patients. First of all, does a consultation and a workup, and then decides on what treatments to do, but he does a lot with eye movements, proprioception, cerebellar function, and the vestibular system. So works with people on motor movement, coordination, balance, awareness of body system or body position and movement. And we really strive for neuroplasticity, which is in the brain where the dendrites make connections with each other. And so people who have like neurodegeneration, there's a loss of those connections, and the brain can actually shrink. So we do things to help improve those connections and improve that neuroplasticity. And then I said neurofeedback and RTMS before, and I'll talk about that now. So before we do neurofeedback or RTMS, we do a QEEG analysis. So we put a cap on somebody, and it measures electrical activity in different regions of the brain. And then we use that to guide our RTMS and neurofeedback treatments. So we actually send our EEGs out to one of our colleagues who reads them and sends us the report back that we can go over with our patients, as well as where we need to treat. Neurofeedback is a form of biofeedback that uses audio and or visual signals to help retrain or reorganize the brain signals. It improves brain function, and it enhances communication signals in the brain. We use it a lot for ADHD. We use it for autistic children, not necessarily to treat autism, but to treat their ADHD. Anxiety and depression, bipolar, memory loss and poor concentration, migraines, OCD, PTSD, and sleep disorders. And then RTMS is a form of brain stimulation that involves using an electromagnetic coil to stimulate nerve cells in targeted regions of the brain. The magnet sends an impulse that can either stimulate or calm specific regions of the brain. So we use that primarily for depression, bipolar, anxiety, insomnia, and some dementia. So to give you an example, for depression, we would want to stimulate the left frontal lobe to help increase that frequency in the left frontal lobe. But for anxiety, we would actually want to calm a region of the brain. So that's, again, based all off of EEG analysis. So future potential treatment options at our clinic, stem cells for Lyme arthritis and neuropathy. I've also heard about intranasal stem cells, although I have heard from one person that they actually cause a mast cell reaction. So that's something that I would have to research more before I ever did that. I did do a stem cell injection on a patient with Lyme disease in her knees, and she's doing great, so it didn't cause any reaction there, but definitely the intranasal is something that I would be holding off on at this time. Some things that I've recently learned about are intranasal exosomes, which are extracellular vesicles derived from mesenchymal stem cells or other cells, and they help to reduce brain inflammation, cognitive impairments, and memory loss. And then nootropics, which are intranasal peptides. So both of these intranasals, they bypass the blood-brain barrier. So they are able to get directly into the brain and help with neurocognitive disorders. So they support cognitive decline, brain damage, nerve regeneration, neuropsychiatric disorders, chronic neurologic disease, and as well as elevated homocysteine levels. And then ozone therapy, which is the administration of O3 for disease treatment and immune system stimulation, is something that a lot of the naturopathic doctors at the ILADS conference talked about. Something that intrigues me. It's not anything that I do yet, but I would like to look more into that and possibly a future treatment. And then IVIG, just another treatment for people with antibody deficiencies. So that's something I'm interested in again, but down the line. So working together, many of my patients are very well educated, as I'm sure all of you are. And so I'm always willing to listen and learn from my patients and work together to try to achieve optimal health. And I just want to give a special thanks to the Minnesota Lyme Association for sending me to the ILADS conference, giving me the opportunity to learn about Lyme disease and hopefully be able to help people just improve their lives and manage their symptoms or cure. So thank you very much for this opportunity.
Is the whole team working? Does the whole team become involved with every patient? Or, I mean, are patients that you bring to them and say, you know, I have this patient and this is what's going on, and just how that works in the team concept?
Yep, so a lot of our more complex patients, because we do a lot of like physical therapy, and our chiropractors have like their long-standing patients who just come in for their adjustments and stuff. But yeah, more of our complex patients, so we actually do team meetings every day at lunchtime. And so if we saw someone that morning or the day before, then we bring that patient information to the meeting, and then we discuss, okay, this is what's going on with this person. I think that, you know, we need to do this, and then everyone just kind of throws in their input. We actually have a lot of, we've spent hours upon hours putting treatment plans together so that they're kind of, we kind of have a format based on what somebody's coming in with, but then we edit it based on each patient. So then we like if we think someone needs neurofeedback or RTMS, then they'll go into that plan. But maybe if they just more so need like some nutritional help, then, so yeah, we work together as a team, so we kind of figure out what our treatment plan will be. Then the initial provider presents that plan to the patient, and then we get everyone else involved who needs to be involved. So if they need functional neurology, the functional neurologist gets involved. Most of our plans have health coaching and classes, so our coach gets involved. So yeah, it's.
And do other members of the team have tick-borne disease literacy? I mean, have any of them worked with Lyme patients, et cetera, before?
Not really, no. This is pretty new to our clinic. So actually, the two doctors that own the clinic are their brothers, and their brother-in-law has Lyme, and it was a pretty rapid onset of cognitive decline, and he was diagnosed with, I think, Alzheimer's at Mayo Clinic, and then we did the IGeneX test and found out that he had Lyme disease. So that's kind of what intrigued our interest in this, but yeah, this is very new to us.
Now, Tiffany, you guys have been treating, though, from what I understand, probably indirectly Lyme patients or cleaning up people with Lyme issues. So maybe not formally Lyme treatment, but as far as the wellness approach goes,
right?
And that piece of it.
Yeah, and actually after going to the conference and going through the PowerPoints, there are certain patients that pop into my head like, oh, you know what, I think that person has Lyme, or I think that person might have Bartonella or something like that. So yeah, we've treated patients with what they thought maybe had depression, and after, I've learned more, I've talked to the doctors like, I think this person actually has this, so.
That's part of what we're trying to do, is continue to expand the resources for people as everyone finds their own approach to healing. And so, they have a pretty good idea on the wellness approach, but looking to balance that off with some of the traditional medicines that can also obviously be an important part of the plan. So I guess one of the questions that I had too was, so where would somebody start? And there's a lot of things, it's like drinking from a fire hose right at the beginning. And so is it coming in and getting consultation? Is that free? When that happens, do people then get a plan? They can choose all or nothing. Where have you seen success if they can't afford to do the all or nothing? Do you start with wellness and then antibiotics? And I know these are all kind of situational, but in general, I know how overwhelming it can be with all of the different things, especially all these wonderful things that are available, but we can only do so much of it at the same time. So how do you help address taking it step by step? Yeah,
so consultation is the initial first step. So it doesn't really matter who you have a consultation with, but because it's going to work its way, it's going to work its way to the right person. But I mean, one of the medical providers probably for Lyme would be the best for consultation. And then from there, we put our treatment plan together and just present it. Now, if that's something that people can't do, we do have payment plan options, because some of I bill as much as I can to insurance, but some of the things that we do just aren't billable. So that's where payment plans come in and are very helpful. So I would say the majority of people probably go through a treatment plan just because we want to achieve that optimal wellness, or what we call as a transformational change. There are people that I work with just single-handedly, more so on nutrition, that can't afford to do a treatment plan, or even do a payment plan. And so we do more of the nutritional stuff because that's what I can work with people on and they can afford, or that I can bill to their insurance.
Is there a certain level of success that you've seen with kind of the wellness approach? I mean, obviously you may not know specifically you're treating Lyme, but the wellness piece is an important part of it. Do you find high success rates with your guys' wellness approach?
Yeah, so we found higher success rates now that we've really encouraged people to do the full plan, rather than people used to, say I can't afford this, and so they'd take things off of the plan, and that's completely understandable, but we just wouldn't see as good of success rates, and then people are frustrated and we're feeling bad, and so we are seeing better success rates with doing the multi-system approach.
Any other questions?
Yeah.
I have two. First one is, do you do any antivirals, and like also the Epstein-Barr? And then the second question, have you ever done any low-dose immunotherapy?
I have not ever done any immunotherapy, so that's something I'd like to look into, but no, I haven't done that yet. And antivirals, yeah, we could do antivirals, so as well as just look at what else is going on and supporting with supplementation, things like that, but yeah. Any other question? Yeah.
I am currently doing low-dose immunotherapy someplace else, and that has been my best success so far when things are going good. But for the last 6 months now, I'm being treated for mast cell activation syndrome. Do you guys treat for that at all?
So that, I would like to say yes, but again, I'm just so new to this that I research a lot, and so I'm willing to work with anybody, but I always tell people that I'm new. And so, like I said, your expertise combining with what mine is something that I'm willing to work with. I actually recently took on a pandas patient, and I really don't know a whole lot about pandas, and I told the patient that, but she has a panda specialist, so I'm just more of her local provider, but I've learned a lot, and they've taught me a lot, and I've, been able to help them, so, but yeah, I'm just not quite there yet.
Are you willing to do testing? If, say a patient walks in and their insurance won't cover IGenics, will you guys draw the blood and send it in for them?
Yeah. Yep, we draw blood, and so I've sent IGenics tests in for patients.
Are you finding some of these insurance companies will not cover that testing, or most of them cover it?
I haven't done a whole lot of it. I think Medicare covers a portion of it, but I don't know about like Blue Cross or other health care plans.
Yeah, I know the person that at IGenics, their Bob, spoke here before, and he said if somebody is on, if they're on Medicare, and they send their copy of their card
Yeah.
through, that it's covered. As long as you guys will take Medicare at your clinic.
Oh, yep.
It's covered at IGenics, they said that. But let's say there's a 20-year-old kid that gets Lyme disease and comes in with his insurance. Maybe it will cover it, maybe it won't cover it, is that right?
Yeah, I'm not completely sure about the other health plans. I know Medicare at least covers a portion, if not all of it, but I don't know about other health insurance.
I've talked to so many people that don't know where to go get tested. If they go to their regular doctor, he'll fight and argue with them and tell them, I know my younger brother went in and he has Lyme also, but he went in, we got all the stuff here that we needed, and he just went in to his regular doctor, and he was really stern with the doctor. I want this test right here, no other test, this one, The doctor went out and he come back and he called IGenics and he said, yes, I will draw your blood and I will send it there, no problem whatsoever. So I think he talked to Bob, I think you know Bob straightened them out right then and there. But he had the big bullseye rash and everything, you know, his knees swelling out.
Yeah.
He's not gonna listen to me, but he listened to a guy from his work that said, well, you idiot, you had a bullseye rash 2 years ago on your back, you know?
Right.
You had Lyme disease, you know?
We do have, the, accredited labs, the ones that we've vetted, Health Dr. Maloney, on our website as well. So, we don't have insurance information, that's just gonna be case by case, but I would encourage you, for those of you in that situation, you could certainly explore those labs, and I think just calling them, they're gonna be motivated to help you get it covered. So I think calling them directly might give you a better information in terms of if it's covered or not. But there's a few different options on there that you can consider. I don't know about the other. And then the other thing that came up that I didn't know, that I don't know much about, which is a lot of topics, I guess, but the magnets and some of the EEG analysis and treatment. So is that symptom relief? Is that promoting repair? Maybe if you'd explain a little bit for someone that has never heard or seen anything like that.
Yeah.
But it'd be good maybe.
Okay. Yeah, I guess I could have elaborated a little bit. So I think a lot of people with Lyme disease or tick-borne disease develop anxiety or depression. So again, treating the underlying cause, which is the tick-borne disease, but then what has manifested from that, some neuropsychiatric disorders like anxiety or depression. So that's something that we treat as well. So not just focusing maybe on the Lyme, but focusing on some of the other things that have occurred because of the Lyme. So the EEG is we have a specialized technician, and it's just a cap, and it's nothing invasive, but it just basically reads your brain waves with eyes open and with eyes closed for a certain period of time, and then we send that into our colleague who gives us a printed out report based on what the brain waves are showing. And so that helps us to direct where we're going to do the neurofeedback or the RTMS treatment. And a lot of times people might come in saying that, I have depression, when maybe it's not really depression, but they just feel sad, but maybe it's more so anxiety. So it's the EEG helps us to direct the treatment where it really needs to go, and not just based off of somebody's symptoms. So, and we've had a lot of really great success with that. RTMS is billable to Blue Cross and Medicare if you've failed 4 antidepressants, as well as I think being in current therapy. But so that's a great option for people who have depression. It's FDA approved for depression, but then we use it off-label for other things. So did that answer?
Yeah.
Just a follow-up to that, when you're using the magnetic therapy,
Yeah.
do you know if they recommend using speakerphone on their cell phones?
Oh, no. So you just can't use your cell phone while you're doing the treatment. The treatment is like between 30 and 40 minutes long, depending on what area we're treating. So you just can't use your cell phone. And you can't have any metal. So like earrings have to come out, glasses have to come off. But otherwise you can use your cell phone once the treatment is done. So that's it. RTMS is pretty intensive. It's 5 days a week for 6 weeks. Neurofeedback isn't quite as intensive. So that's a couple days a week for 40 treatments. So that spans out over a few months.
I used to measure how much brain tissue would heat up from cell phones.
Oh, yeah.
And when you're talking about the magnetic therapy, the two are sort of
Yeah, okay, I understand what you're saying. Any other questions?